Hi, my name is Kat Pollak, and I'm a social psychologist, and I've been at Duke for about 13 years. And some of the work I do is to help doctors and patients communicate better. And one of the studies I did a couple years ago that is influencing the work I'm doing now was we're looking at how doctors talk to patients about weight. And what we found was doctors spend about 3 minutes talking to their patients about weight. These are adult patients. 3 minutes out of about an 18-minute visit, so a good chunk of time. And talking about weight in and of itself did not help patients lose weight. But when doctors use specific techniques that we think are effective, they're called motivational interviewing techniques, patients are more likely to lose weight 3 months after the visit, whereas they were gaining weight otherwise. So with that information, we wrote a grant to teach pediatricians and family physicians how to talk to adolescents about weight, and we are targeting those specific behaviors that we learned were effective with adults. The study is called Teen Chat, and we're recruiting 50 doctors, and we're audio recording their visits with 600 overweight and obese teenagers. And what we're trying to test is an intervention to teach these doctors how to use these motivational interviewing techniques. And so half of the doctors will get this intervention that includes their own audio recorded conversations with their teenagers and to try to teach them some of the skills. It's a web-based intervention, and this is the first study that has audio recorded teenagers and their doctors. So this is really exciting work. We're in the baseline phase right now, and we're rolling out the intervention this summer. And I would say all the doctors and patients are quite enthusiastic about this study, and we're very excited about it. And it's addressing a really important issue, adolescent obesity, which, up to 30% of adolescents are overweight or obese, and some of them are having type 2 diabetes, hypertension, high cholesterol, which have just been unheard of in the teenage population prior to the last 10 years. So this is an epidemic that we really need to address. The other part of my work addresses doctor-patient communication with cancer patients. My colleague, Dr. James Tulsky, and I did a study a couple years ago called SCOPE, in which we trained oncologists how to address patient emotion at the end of life. A lot of patients come into their visits with significant distress, and they expect their doctors to help them feel better. The problem is those visits are awfully very busy. There's a lot of medical issues that need to be addressed, and some of the emotional needs aren't addressed. And so our intervention trained the oncologist how to address patient emotion when it arose. One of the things we found from that study is that patients don't express their emotions very often, and so that was hard for doctors to address them when it did happen because it was a relatively rare event. But our intervention showed that we could teach the oncologist how to communicate better. They doubled the number of times that they used the skills that we were teaching them, so that was really exciting. What we learned from that work is that patients, again, weren't expressing their emotions as much as we thought they would given their levels of distress, but also they expressed their emotions in a way that doctors had a hard time knowing that they were distressed. They might say something like, are the tumors getting bigger? And the doctor would respond with a medical answer. Well, the tumors were 3 millimeters, now they're 4 millimeters. What the patient is really saying is, I'm scared. I'm scared the cancer's getting worse. And so we're teaching the patients how to express their emotions in a more direct way that the doctors can respond. And that study is called COPE, and we're recruiting 400 patients here and at the University of Pittsburgh. We're just in the first year of recruitment, and this study will be ongoing for several years. So these are the two studies I'm working on right now to improve how doctors and patients communicate.